Welcome to Medcastplus. I am your host, Dr. Jack. On Medcastplus, we aim to bring local healthcare providers and physicians to discuss important topics relevant to our health and well-being. As we approach summer, this would be a good time to discuss getting a checkup with your primary care physician. As we know, part of a well checkup with your doctor includes getting a blood pressure test to detect high blood pressure, a common silent killer. Nearly half of all Americans have high blood pressure or hypertension, the medical term for high blood pressure. Unfortunately, many may not know they have this disease, and there are serious potential health consequences of untreated high blood pressure. These include damage to the blood vessels, and it is a significant contributing factor in the development of heart attacks and strokes. In addition, high blood pressure is a leading cause of kidney disease. High blood pressure can begin at any age, and the best way to find out if you have high blood pressure is to get checked by your physician. We welcome today Dr.Serge Balmir. He is a board-certified internist and nephrologist. He is an accomplished physician here in Brooklyn. His practice is located in Midwood, and he is on staff at Mount Sinai, Brooklyn, as a voluntary attending physician. Welcome, Dr. Balmir, to Medcastplus. Thank you for coming to help educate our viewers and spread the word on checking for high blood pressure, the importance of seeing a primary care doctor like you.
Thank you for having me.
And also, you are a kidney specialist.
Yes.
So you are board certified in internal medicine and nephrology.
Yes.
Tell me about the study of nephrology. What does a nephrologist do?
Nephrologists can be called to assess many things that might be wrong with a person, but usually we're called for people who have kidney disease or kidney problems or kidney-associated problems. And of course, there are other things nephrologists can take care of, which include maybe high blood pressure, electrolyte disorders such as high potassium, or if your sodium is low. So many things that the kidneys do that nephrologist is called upon to review and to help the internist figure out.
And aside from being a specialist in the kidneys, you're also a board-certified internist. You practice primary care, from what I understand. How many years of training did you have to go through in order to get where you are today?
I feel like I'm still training, but medical school was 4 years, internal medicine another 3 years, and then a fellowship for me was 2 more years on top of that.
So a number of years go
Yes.
into just becoming a physician after college of 4 years, medical school 4 years, then you said you had another 5 years. 5 years of training as a resident and a fellow in a hospital to learn to do what you do today.
Yes.
And as you mentioned, you feel like you're still learning, and that's important for all of us and for our viewers to understand that doctors are always learning, or at least they should be.
Things change.
Right, all the time. We've had some new guidelines on blood pressure, which we'll talk about today, and you've maintained your board certification, which means that the doctor is up to date.
Yes.
Very important. So let's start off with, for our viewers today, it's approaching summer, spring cleaning, but that also is a good reminder that, hey, maybe when we have some time off this summer to go and see a primary care physician. And for people who haven't seen a doctor in a long time and they feel fine at home, they don't think they have any medical problems, why is it important to get a well checkup with their doctor?
Well, many things out there, that many diseases, you may not know that you have them. Some things, there are no symptoms initially. And if you do have symptoms, you're probably already late to the game. So seeing a primary care physician can at least find out what things might be bothering you, how better to improve your lifestyle, change some bad habits if you have them, and of course maybe diagnose some disease that may have been a part of your life that you didn't know about because you hadn't seen a physician in a while.
Right, so there are diseases we know of that can start without us feeling anything.
Yes.
They can start without us having trouble with walking, talking, with sleep, changes in our habits with our bowels or urinary tract. Certain diseases just start off silently, and finding them early is important. So when you see a patient for the first time and you're searching out for some of these silent diseases, silent killers, what are you looking for the first time you meet with a patient for a well visit?
Simply just general questions. How are you feeling? You sleep well? How's your appetite during the day? Have you been losing any weight? Are you comfortable when you walk around? Are you short of breath? Just general questions, trying to find something that might be bothering them that maybe they're not aware of as being a problem.
Yeah, when I see a patient in gastroenterology, we talk about bowel habits. We talk, do they go to the bathroom enough? Do they go too little, too much? When it comes to the kidneys, how does the urinary changes or color in the urine, the findings that someone might see when they go to the bathroom, how does that sort of tip you off to something?
Those can be subtle. Sometimes simple question is, do you find yourself urinating as much as usual? If you had a decrease in the amount of urine that you might make throughout the day. Did your urine color change? Is it getting dark? Is it red? Do you have pain when you pass urine? So these can be symptoms of something else that may be going on in the body, whether it's related to the kidney or some other organ.
Right. For men watching, that could be a sign of issues with the prostate.
Prostate infection, right? Bladder cancer, or simply maybe the prostate is getting enlarged.
And then with kidney disease itself, where the kidneys don't produce urine enough, that could be a sign that someone has underlying disease of the kidney system.
That's very possible.
Right. So let's talk and transition over here to a major problem. Something that nearly half of all Americans suffer from, and you see as a specialist in, is high blood pressure. So tell us, what is the magic number these days? I know there have been some changes from the associations that we follow. What is high blood pressure? And tell me what the magic number is.
So the magic number we try to aim for is 120/80. Anything more than that is considered high blood pressure, and there are different stages of high blood pressure as well. The high blood pressure is the force of the blood that's pushing against the walls of the artery. So when the heart pumps, blood comes out of the heart and it pushes against the walls of the artery. So a high blood pressure is when that pressure is too high. And the concern is that when that pressure is too high, over time, it can lead to damage to many organs within the body. And that's what we try to avoid as nephrologists, as internists, as cardiologists, just to make sure that the blood pressure stays in some sort of a near normal range to prevent these complications that can happen later in life.
And this is like any other plumbing or piping system that we have in our home or in our car, that if the pressure were to overcome what the pipe is meant to handle, there could be damage.
Right. So the blood pressure, when it's high, it's going to look for the weakest point. Or over time, it's going to wear something down, like any problem you might have with plumbing might do. And you'll basically have a leak somewhere. That leak could be kidney disease, could be a stroke, could be a heart attack. So many things can happen when blood pressure is uncontrolled.
Right, and some of the major side effects of high blood pressure are?
Of course, stroke, stroke with bleeding, kidney disease, heart attacks. You can lose your eyesight. So high blood pressure can lead to many complications.
Major complications. I mean, our blood vessels go anywhere and everywhere in our body. So we're talking about a major structure within the body that if the pressure is too high, untreated, we're talking about eye disease, heart disease, kidneys, brain.
Yes.
So very important to treat. So when you meet a patient and you find high blood pressure and you see those numbers that come up on our screen or in the pharmacy when we check our own blood pressure or at home, which one's more important? Our folks today watching are wondering, is it the top number? Is it the bottom number? What are we looking for? Which one's more important?
Oh, they're both important, but right now most of our focus is on the top number, what we call the systolic blood pressure. So again, we try to aim for a systolic blood pressure of 120. And the bottom number is called the diastolic pressure, and we try to aim for a number of about 80. But they're both important, but treating both definitely decreases any sort of morbidity or mortality, but the focus is mostly on the top number.
So Dr. Balmir, someone comes in with high blood pressure, what are the first steps you take in treating it?
First, we want to find out what their lifestyle is like. Are you eating too much? Are you overweight? How many drinks do you have per week or per day? Do you have a family history of high blood pressure? Are you taking any sort of illicit drugs? Is there something in your day that's causing you to have a lot of stress? So those are the usual things that I start with. And give them a trial sometimes if the blood pressure is not too critical. Give them a trial sometimes of trying to address those social issues or those dietary habits. Bring them back for a follow-up, and if it's still high, then maybe have to decide on using some medication.
So folks who have high blood pressure that are watching today, there are options beyond medications or prior to medications. So things that we do in our life like smoking. How about coffee? Do you think coffee affects us, or stimulants that people take?
It is possible that coffee can affect blood pressure, again, in moderation. So if someone's drinking multiple cups of coffee a day, it is possible the caffeine can increase blood pressure or make them feel like their blood pressure is high.
And smoking can play a role?
Smoking in general should be avoided. It affects all aspects of the body. Smoking affects the heart, affects blood vessels, affects the kidney. It's one of the things we tell people to stop doing.
So the lifestyle modifications are important. Let's talk about exercise a bit. I think it's something that in my practice I see can help patients, especially, for example, with heartburn. I find that when my patients exercise, lose weight, their waistline shrinks. and they're in a good exercise regimen, their disease gets better. Tell me a little bit more about what you recommend to your patients.
So hoping that the patient's healthy enough to do some exercise, because sometimes some patients have issues at just walking. But if you're able to, 30 minutes a day of light exercise is good for maintaining weight, using up extra calories, maintaining blood pressure. If you have diabetes, it may help also help with some control with the diabetes along with the medications that they're taking. So generally 30 minutes a day of light exercise as you can tolerate it.
And we hear sometimes on TV or at the gym, there's a sign that says, check with your physician before starting any new exercise regimen. Why do you think that that's important to meet with your doctor or see a doctor for the first time before initiating some type of new exercise like running or biking or heavy weightlifting?
Well, there are some people who lead very sedentary lifestyles. So when they begin an exercise regimen, it can be a large stress in their bodies, whether that's something as simple as maybe having some joint pain versus something more serious as having some issue with their heart, finding out they actually have heart disease through a heart attack.